Devex events. We have been hosting many events for several months now during the pandemic about the COVID pandemic itself, about the implications on the economy, on global development, on global health. But this is the first event that we are hosting on what, to me, and I think to many experts in this field, is really one of the most important issues that's really been underreported to a degree. And we're here to talk about access to modern contraception and how it's been impacted by the COVID pandemic, what some of the challenges and problems are. It might be surprising as you hear about this, and what some of the opportunities are too. We're going to break a little news. We've got quite an incredible lineup of experts, and we're really honored to be doing this event together with one of the leading companies that works in this field, Bayer, and their pharmaceutical division. I'll be joined shortly by the president of Bayer Pharmaceuticals, Stefan Oelrich, and we're going to be talking really at a deep level about what does this issue of access to modern contraception look like during and after this pandemic period that we're through. For those of you who are familiar with this issue, I'm telling you something you know well already, but there are more than 200 million women in the world today who want access to modern contraception but can't get it. That's more than all the women who live in the United States, just to give you some sense of scale. And this is a massive issue, not just for people's personal dignity and agency and choice, although that's obviously essential. It's also a development question. It's connected to poverty. It's connected to child mortality and health. It's connected to so many of the issues of women getting an education, having political voice, being able to rise up in their own societies. And it has long been understood in the development sector as one of these key issues, a key pillar of global development and human rights. And yet, as I say, there's very little conversation today during this pandemic about how it's being affected. And so we want to change that. And I want to thank all of you who are joining from around the world who are eager and interested to hear about this issue. We're going to really include you in the conversation today. We're doing that in a couple of different ways. One is that there are some poll questions we're going to be throwing out during the conversation. And so we're asking for all of you to pay attention to those questions when you see them and answer them. We'll look at the results. It's a fascinating thing to see how we all think about this issue. You can begin putting in questions anytime you want. We're going to try to reserve some time at the end for a few questions, but during the course of the conversation, I'll be reviewing your questions and comments and trying to bring them into the discussion as much as we can. And as I say, we have an incredible lineup of speakers. So just to tell you a word about who they are, we're going to begin with a conversation with Stefan Oelrich, who I mentioned is the president of Pharmaceuticals at Bayer, the massive German and international company that I think you all know. We're also joined by Mariarosa Cutillo, who is the chief of partnerships for the UN Population Fund and a leader on these issues. I'm eager to hear her take on this and to hear more about what the UN and the UNFPA are doing. Roopa Dhatt, who is the executive director and the co-founder of Women in Global Health, a large network of health professionals, is going to bring in the health worker perspective and her own thoughts about these issues in a later part of the discussion. And we'll also be joined by one of the world's leading experts on supply chains and global health. That's Dr. Prashant Yadav, who I know you've seen in Devex's pages and events in the past. So it's really an action-packed, expert-packed, detail-oriented session. I think you're going to all learn a lot, and I'm looking forward to learning a lot myself. So let's begin, if we can. I want to ask, let me just say one thing before we begin, which is we do have an opportunity for those of you who are joining us on social. In addition to throwing in your questions as you're watching the video, you can tweet at hashtag the power of choice or hashtag Devex event, and you can follow the event there and see all that's happening as we have the conversation here. We also have our friend Chris Shipton back with us again. He is an illustrator, and he's going to be illustrating the conversation, and we're going to be sharing that as well after the event. It's a great way to stay up to speed and to see what some of the main points are as they come out of this conversation. So we're going to begin sort of imagining, as we all are at home somewhere in the world, and I'm in my own home here, kind of a fireside chat, as though we're all in a living room together, because we want to have a deep conversation with Stefan Oelrich and Mariarosa Cutillo. I want to ask them to turn on their cameras if they would, and to say hello and to join the discussion.
Hey Raj, hi everyone.
Nice to have you here, Stefan and Maria Cutillo.
Hi, Raj. Hi, Stefan.
Thanks for being a part of this. Stefan, let me start with you. We're delighted to be hosting this event with you at Bayer. You are, maybe not everyone knows, one of the world's largest providers of modern contraception, and you made a pledge that sort of set me back a little bit when I heard it maybe 6 months ago or so, that the company is planning to reach 100 million women who don't have access, mostly in low and middle income countries, and reach those women with modern contraception, provide access by 2030. 100 million is almost half of the global gap that exists today. So it's a massive pledge to put out there. And again, you're a company that's been working on these issues and is a major provider. So I'm curious, from your perch as the president of Pharmaceuticals, tell us what you're seeing during the pandemic when it comes to access, when it comes to supply chains, when it comes to uptake of modern contraception. What's the picture look like from your seat?
Yeah, thanks, Raj, and great to be here with you today. So the pandemic obviously has put a big change into all of our lives. For us, it's been a huge disruption at all levels, and I think as for everyone. And many people approach me and say, "Well, you're in the good sector. You work in healthcare, so you must be thriving, and everything must be just dandy for you guys." And I can tell you that is not always the full truth, because obviously for us. Other than, like, I guess any company and anyone in the world where you put the safety of your employees first, and then you look at in our sector and our line of business, you look at how can we make sure that we can continue to supply the world with the medicines they need. So for us, we have a lot of people, like everyone else, that are staying at home. But throughout the entire crisis, all the people that could not work from home and that were elemental and instrumental to producing medicines, but also to doing research in our labs where that you couldn't do obviously from home. So these people continued, and I'm extremely proud to say how responsible they handled this, because we had throughout all of our entire production sites, we had no absentees through COVID-19, meaning that nobody got infected. It's almost, people could say it's a miracle. I would say it's linked to responsible behavior. And we've seen that time and again in this crisis, that if you behave right, you're much less likely to get infected. So even in sites like, we have factories in Brazil, we have factories in Milan, Italy, and they continued on a 24/7 schedule. Now, while we did continue without any breaks in there to manage our supply chain, there were some disruptions, but they were more political in nature. So when all of a sudden the Indian government, for example, is considering to put an export bans on certain medicines or certain intermediates to produce drugs, so that's something that governments had to address, and we've been actively collaborating with policymakers in multiple countries to make sure that these supply chains would continue to be functional. And I'm really happy that in our case, that has worked out really well. Where we've seen more of an issue, quite frankly, is with patients. And in our case here, what we're talking with women being afraid to go to see their provider. And that has led to a significant decrease of visits, office visits to physicians. And when you think about, for example, long-acting contraception, you can't just go to a pharmacy, get that, and then you're done. But you need a physician intervention. And we've seen, especially in the month of April, but also April, May, we've seen significant reductions in units of product for long-acting contraception being placed. In some countries, we had up to 70% reduction. It was really dependent on geography. And you can imagine in those places where COVID hit the most, we were also most affected. So this is obviously bad news for women when you cannot get access to the contraceptive method of your choosing in this situation.
I want to, in a moment, ask you, Mariarosa, to give us that global picture, but just a quick follow-up on that, Stefan. I'm interested to know, in some places in the world, due to the stress on the health system, non-essential surgeries were canceled or delayed. Other kinds of less important, people might say, quote unquote, medical services might have been reduced. Have you seen a challenge in that case for women who might be living in a place that's heavily affected by the virus? And so it's not just that they're afraid to go for good reason, that they might contract the virus, but also that the services just aren't there. Is that an issue as well?
Yeah, that again depends by geography and how the health system is organized. If you take China, for example, you have to get to a hospital. So there, these type of procedures will be or would be reduced during the month of, for in our case, especially March and April in China. Then in a lot of countries, these go through private offices, and for OBGYNs that are typically the ones that provide long-acting contraception, there is no real need to scale down on other elective treatments. There, we've more witnessed the fact that either some directly closed their offices or saw significant reduction in women coming into the office out of fear to get infected. And so we've seen as people and as hospitals were asked to reduce elective treatments and postpone them, I think a lot of patients that would go to see doctors would also reason that, well, maybe I should stay at home as well. And we've seen, I mean, that when you look at the pathologies that present today in hospitals, this is not our topic, but when you look cardiology, for example, there are people that cure their heart attacks at home out of fear to go to a hospital. That obviously runs completely counter to what we need from a public health perspective.
Yeah, and we all know we're just kind of waiting for that other shoe to drop as we see, more longer term issues like cardiovascular disease become a bigger problem months from now, because people weren't seeing doctors or weren't having the prevention that they need. Mariarosa, what does the picture look like for you at a high level? I mean, you're responsible at UN Population Fund looking at the whole world. How big of an issue is this really today?
Well, it is a big issue. And Raj, let me just say, and thank Devex for organizing this conversation. It's very timely, because I think we need to send a very crystal clear message here. And the message is that the sexual and reproductive rights agenda has to remain in the spotlight. And this COVID-19, not only is it impacting the achievement of the Sustainable Development Goals in general, but it is really putting at stake this agenda. So this conversation is very timely, and I hope this is just the beginning of this conversation. What we have seen, of course, being the largest supplier of donated contraceptives, and as the leading UN agency in our mandate, what we have seen is, of course, an impact on the supply chains. At least at the beginning of this pandemic, there was a very strong impact on the supply chain in terms of disruption. Then, of course, we have put in place a number of remedies, a number of measures, but that was really a striking picture.
You mean, like, Mariarosa, just so I understand it, you have the money, you want to make the procurement, and the supply is just not available at that moment.
It's not available. So we had identified at the beginning, for example, at least 20 countries where that disruption was really, really putting at risk completely the power of choice. And that was, so this identification started from the beginning of the outbreaking of the global pandemic until, I would say, the end of April. Then we have started working, we have started partnering even more, we have started increasing internal communication, we started working much more closer with governments, and we were able to put in place a few measures that now allow us to control this adverse impact on the supply chain. But that was the worst, let's say, and really dramatic picture we had at the beginning of the pandemic. So this is I would say, the first broad, let's say, observation around the impact. The second one, and being always under the general and global perspective, is that this pandemic is actually impacting very strongly and negatively inequalities. We're seeing that particularly in the rise of gender-based violence. We're seeing that in the rise of harmful practices. I can just give you a few numbers here, but there is a research, and I'm happy to share the link with all our audience. There is a research that UNFPA has published at the end of April, and together partnering with Avenir Health, with Johns Hopkins University, with the Victoria University in Australia, on how the outbreak of the COVID-19 is impacting our 3 zeros. So the 3 zeros of UNFPA are, of course, achieving zero unmet need of family planning, achieving zero maternal deaths, preventable maternal deaths, and achieving zero gender-based violence and harmful practices. Now, this research will tell you that, for example, if this pandemic, the lockdown, and the consequences of the pandemic go on for the next 6-9 months, for example, in the next 10 years, you will have 113 million more child marriages. And you will have in the next 2 years, 47 million more women who will not have access to contraception. So this research gives you the projection. And this projection sends a very clear message. We need to act now. I always say for the SDGs, there's no time to lose. Well, now it's a time to act with urgency. And I think this also links me to the other point I wanted to make, Raj, and I'm sure we'll go into that with Stefan even after, but partnerships are key. The commitment you mentioned before, the 100 million women that Bayer committed to, is actually the commitment that Bayer made last year at the Nairobi Summit. At the Nairobi Summit, that was celebrating 25 years from the Conference on Population and Development. And it's a commitment from a partner from the private sector that tells you a very long story on how what we once called the non-traditional partners are key now to achieve, particularly to somehow face the negative impact of the COVID-19.
Yeah, let's ask you, Stefan, about that exactly, because it is such a dramatic number. We've heard some big numbers. Let me just outline them for everyone. We've heard there's 214 million women in the world that don't have access. That's the latest figure we have. Mariarosa just said there's an additional 47 million women who could also face this challenge of access to modern contraception if we stay on the trajectory we're at. And Bayer has made this commitment last year of reaching 100 million women by 2030. So tell us more about what does that actually mean? I mean, is this an easy thing to do? Do you just turn on your factories for a few more hours? What does it mean to actually reach a number like that?
Raj, I wish it was easy, but then probably if it was that easy, Mariarosa wouldn't be so much supportive of what we're doing and laud us to the degree that I feel extremely proud about when listening to you, because in the end, what we're doing and our contribution to sustainable development is and has always been a core element of our company strategy, and that we, like very few other companies, are actually capable to contributing to quite a number of the UN SDGs is, I think, remarkable, and it goes beyond even healthcare and also as we support food and the agricultural sector. Now, when it comes to family planning, modern contraception helps to strengthen the role of women, of course. We've heard about that. Because it helps them determine their own path in life, often with positive effects on family and communities. And that's why we want to support this. In low and middle income countries, the need for family planning will even increase in the years to come. So how do we get there? How do we reach out to those women? Well, we first need to create a capacity to do that, because it will not be sufficient to just offer more condoms or just send in millions of oral contraceptives, because we know that especially in certain societies, is not going to do it. We strongly believe that we will need more access to long-acting contraception, because also from a social perspective, that will allow women to not be stigmatized but in their environment for using contraception, because you will just not see it for 5 years that she elects this method of contraception. So nothing of that will come easy, because we will need to create capacity to actually satisfy that type of demand. We're committed to building actually an entire factory for that matter, because our current output of product will not be sufficient to satisfy this demand. And of course, we will have to, Mariarosa said it, we will have to partner. We will have to partner with a lot of the stakeholders. We've done so successfully over the past years, but we will need to step up and even do more.
So I teased earlier that we were going to have a little bit of a breaking news announcement here. So let's get to that now, because it is about a partnership between the two organizations represented here, Bayer and UNFPA. Mariarosa, can I just turn to you to say, what is this announcement you wanted to make today at this event? What are you doing together in partnership?
So we are actually leveraging on the expertise, on the innovation that Bayer can bring to work on our supply chain and our medical logistics in some identified countries where the humanitarian need is now more prominent. And I have to, if I can, I have to tell you something, because this partnership has been in the making for a long time. We've had discussions with Bayer. You know, it's really a matter of aligning languages, as I always say. You know, I come from the private sector, so I mean, it's really important to find the right deal. And I have to say, this discussion is positively going on for many months, but the COVID-19 has made this so quick and urgent that we were able to kind of frame the partnership in a very smooth way in a very short time. So the COVID-19, I think, in building partnerships taught us something on how better we can make the business of partnerships.
Shows us how fast we can work when we have to.
Fast,
right?
We can act fast, we can act with urgency, we can really deploy the right solution. Because what we are identifying with Bayer, and it's a co-creation process, it's really innovation, it's really expertise that addresses the specific needs of UNFPA in specific countries. And I would say that the added value that our organization brings is really a very strong presence at the country level. So it's a very, I would say, grassroots partnership. I don't know, Stefan, what you think about that, but it has a number of elements of interest that we really need to learn.
So COVID-19, actually, when you think on partnerships, I think has completely changed the quality in the interaction between government entities and policymakers, also organizations like the UN. I was yesterday together with the Director General of the WHO on. We were initiating the microbial resistance initiative that we've just kicked off, and I see a different type of willingness to work together over the past 6 months. I've seen this in policymakers around the world, in the United States, throughout all of Europe, and also in other countries, like in China, for example. And I said the other day jokingly, sometimes now some policymakers are faster than the private sector all of a sudden, when before we were complaining that they wouldn't move fast. That's no longer the case. I just hope that we can preserve some of that. And obviously in this initiative, we sort of piggybacked on this and made things faster. I think it's a great lesson. And you could wonder, why are things all of a sudden going faster? Well, there is a need, of course, to speed up things, but this is not just it. There's also a need to trust each other. And I think we're putting the proof to it by our actions as we speak. So it's not just talk, and we're not just having meetings and we're flying around the world to have fancy conferences. We're actually doing things. And we're making this in a way that is tangible to people, and in our case, to hopefully to 100 million women who will get access to contraception when before they couldn't.
And this is maybe part of the silver lining of the new normal. We've got lots of things in our agenda we're going to jump to, but let me just quickly ask you, Mariarosa, can you mention one or two of the countries where this partnership is going to be taking place so we can really ground it?
So Raj, we are actually still identifying those countries, but I would predict that one of those most probably will be Syria, and Yemen. But again, they're not determined yet.
Okay, but just so we understand, you're looking at some of the most challenging humanitarian situations in the world where women lack access to contraception, and together you're going to find a way to actually get contraception there to those women who need it.
And I have to say, Raj, this makes part of, so UNFPA has launched an appeal for the COVID-19. And we have identified some priority countries. Of course, the work that we are doing strategically with our partners looks into those priorities. And of course, Yemen and Syria, and Yemen, you might have heard, of course, recently, all the appeals that we have launched and the UN has launched is one of our main, let's say, points of concern and interest. So for sure, we will start with those priority countries.
Great. I appreciate that. And thank you for bringing that announcement here. It's something, of course, we'll follow at Devex. We're going to move to the panel. I just want to ask that we can throw up the first poll question, if the producers can do that. And I thank the folks who are following this conversation from around the world. We're getting lots of questions coming into us, but we want to get all of your take on this question of what is the most important in order to ensure access to contraceptives during COVID-19. And while you're answering that, I'll just ask our next panelists, Prashant Yadav and Roopa Dhatt, to please activate your cameras and unmute yourselves so you can join the larger panel conversation we're going to have just now. And we'll see what the answers are like to this poll question. Maybe we can throw those up. The options here are ensure strong supply chains, cross-sector partnerships for delivery, and raising awareness of access to contraceptives as a women's rights issue. Let's see what the numbers look like if we can. Well, it looks like awareness as a women's rights issue is coming out with a plurality of responses here. Cross-sector partnerships for delivery comes after that, and then ensuring strong supply chains. We're actually going to get into all of these. We've heard a little bit about partnerships already. But we're going to get into all of these questions now with this fantastic panel that we have here. And maybe I can start with you, Prashant Yadav. You are one of the world's leading experts on supply chains. And we got into this a little bit with Stefan and Mariarosa. I'd love to hear from you directly. What is the status of global supply chains for modern contraceptives?
Thanks, Raj, and thanks for having me and the kind introduction. So I think a lot of attention very quickly goes towards, do we have contraceptives? Is the supply chain getting disrupted for contraceptives? And I think there we have a reason to celebrate. The decades of work that has gone into building the partnerships between UN agencies such as UNFPA, private philanthropy, bilateral donors, and companies like Bayer and others who manufacture modern contraceptives. Those partnerships, which have focused on how do we coordinate supply across countries? How do we ensure there are forecasts that are available to manufacturers? How do we make sure that we have visibility of inventory and stock in the supply chain? They are paying off, and they've paid off in a way that whenever we saw risks of disruption, similar to what Mariarosa was describing, we've been able to rebalance supply or coordinate things in a manner that there isn't necessarily a shortage of contraceptives, which is the reason for disruption. But I want to highlight another part, which I'm guessing Roopa and others would get into, which is it's not just about disruption to the supply chain for contraceptives. It is also disruption to things that we need for the health and safety of frontline health professionals in order for service continuation, right? So if we are able to ensure there is enough PPE reaching the providers who are providing contraceptive services to women around the world, that's what will guarantee that the demand side and the service delivery side doesn't get adversely impacted due to the pandemic. Then I think another part to keep in mind is that contraceptives are only a part of the set of things that we need for a broader sexual and reproductive health agenda. And in contraceptives, we put many of these coordination mechanisms, these visibility tools in place. And it is giving us now tremendous learning to see how we can put similar things for other products in sexual and reproductive health which haven't received such attention. So I think that's probably an area where we need to spend some more time and focus on. And the last thing is that many of the tools that we've developed have not been as actively working for conflict settings or for very vulnerable regions of the world. And so I'm excited about some of the countries that Mariarosa mentioned. I think that's where we need to put more effort in ensuring that the supply chain, not only during the times of the pandemic, but in general, continues to be robust and continues to supply to women who are in very rural, remote, or other conflict regions, or are vulnerable in other ways. So that's my quick response.
Well, I'm glad, Prashant, that you highlighted the success story here of investments in systems and infrastructure, because those are often the hardest for leaders like Mariarosa, who has to, generate funding from donor governments. So sometimes the hardest things to get funding for is that infrastructure, the core infrastructure. And as you say, it is now working. And it just shows, I think, what the last 10 or 15 years of investments in these areas can really bring us. Roopa, Prashant began to describe this question of what this looks like from a health worker perspective and the broader systemic issues at play. How do you see it from your perch at Women in Global Health?
Yeah, so I just want to echo a bit of what Prashant and build on what's been said. And I think really just the fact that we do need to acknowledge, the hardest to reach, the most vulnerable populations. So what we're hearing directly from our chapters or 20 places around the world, 20 different countries, is really that COVID-19 is diverting health resources from all parts of the health system, but countries everywhere must really still include maternity and reproductive health as essential health services. And that's not something we're necessarily seeing. Childbirth and love doesn't stop for pandemics, but often that's the first part of the health system that's being asked to shut down and not be considered as essential. We have already seen this from the Ebola outbreak. There's an increase in maternal deaths as women were unable to access safe delivery facilities. And there was also an increase in unsafe abortions. So what we, when we don't learn from past lessons, women and girls really do end up paying with their lives. We've heard the numbers from UNFPA, so I won't emphasize those numbers more than the fact that these numbers in millions are only going to continue to go up, and we can estimate even 18 million more unattended pregnancies in the coming months. But more than numbers, it's really also the experiences that people are having. In COVID, there has been a universal experience in the lack of maternal care. It doesn't matter if you're in a high-income country or a low-income country. Women have been denied health care. They're asked not to come to the hospital for childbirth. Couples in infertility treatment have been abruptly stopped, and that's also part of the comprehensive way at looking at sexual reproductive health. Women in the health and workforce are not given decent work conditions, not the appropriate physical protective equipment that they need. What we are hearing, especially from health workers such as midwives, that they're being asked to shift tasks and not focus on essential care that they've been trained to do, especially for women and infants, and instead focus on the COVID-19 response without appropriate training and protection. They face violence and harassment. And then, stepping beyond the health sector, we have to also talk about the economics. We are witnessing that girls and women are entering into extreme poverty. In the health sector alone, 50% of what women do is in informal, unpaid work. So this COVID-19 is really showing existing problems. Girls and women have little to no choice. In some countries, they are having to trade sex for access to food and essential needs. And these are all preventable tragedies for women. We believe that if men and women were in equal numbers in health leadership, this would be less likely to happen.
Yeah, very important points. And sometimes we in the global development field can be very technocratic in the way we think and talk, and we forget these are real people living in very challenging circumstances who just want basic access to health services that we should all be considering essential to anyone who needs them, right? And with the issue of global poverty, which we're hearing now is going to go up, the latest estimates from the World Bank suggest the pandemic will have those numbers increase, are so tightly linked to issues like child marriage, access to contraceptives, to women's rights in general, that it's really important to remember these things are linked, and this is everybody's agenda. It's not just the agenda of people who directly work on reproductive rights. So I really appreciate those comments, Roopa. And I think Mariarosa might want to jump in on this. I'd love to hear your take, Mariarosa, about, Stefan talked about how this pandemic has changed the way we work, and there may be some upsides to that, some opportunities to move faster and do things differently. Is there an opportunity to reframe these questions around family planning and get some more urgency behind such an important agenda?
I think so. I think that we don't have to miss this opportunity. I think one of the things that I think Prashant was mentioning, lessons learned. We don't have to forget the lessons that we learned before this pandemic. Unfortunately, we live with emergencies. We live with humanitarian emergencies. We learn a lot from those. And we don't have to forget what happened before, but we don't have to forget what this pandemic is teaching us. So I think one of the main points that we really need to put on the table is the resilience of supply chains, for example. The fact that these supply chains need to be so strong that if another event like a pandemic, or if this pandemic goes on, we don't build everything from scratch from the beginning. So that is a very important point for me. The lessons learned, the investment, and making sure that once for all, I think this is the time to launch a very, again, crystal clear message. The SRHR agenda has to be part of the universal health coverage discussion. It's time to somehow, as we say in Italian, clean the table from every type of misunderstanding. It's time to decide now. And that will be something that, of course, will influence also the investments and the resilience of supply chains. And again, as Roopa was saying, we always talk about leaving no one behind. This is one of the pillars of the work of the United Nations. And I would say of all the partners that work for achieving the SDGs. So leaving no one behind, at this time, we have a chance to show concretely what we can do to reach out to the furthest left behind and really leave no one behind. So I believe this, resilience, investment, but making sure that we have a final honest conversation in having this agenda as a crucial part of the universal health coverage agenda.
We have a number of questions coming in, Mariarosa, for you and others. So really appreciate those thoughts, and clearly people following this appreciate them too. The second poll question is very relevant to the conversation we're having right now. And that's really about the private sector and how they can best support access to family planning, contributing know-how and expertise through direct financing of contraceptive initiatives or through public-private partnerships. Again, please answer this question for us. Those of you who are following along, we want to get your take. Please continue to add questions. We've got an interesting set of results here. Through public-private partnerships is a vast majority of responses about the opportunity here. And I guess maybe you're influenced by hearing these big commitments and announcements from Mariarosa and Stefan earlier in the conversation. Through direct financing of contraceptive initiatives gets about 20%, and 9% contributing know-how and expertise is the best thing for the private sector. So it sounds like what those following along want to see is more action along the lines, Mariarosa, of what you were describing. More specific partnerships. You know, we've heard this term vaccine nationalism that I think Richard Hatchett at CEPI has put forward, and others. What does it mean to have governments now maybe stepping in where the supply chain has previously worked? It has been very global in nature. What does it mean now for the supply chain, Prashant?
Yeah, so I think similar to what Stefan said earlier in his opening remarks, I think we've found technical solutions, and that's what I was describing about, visibility tools, coordination tools, but none of them can solve a political coordination problem. So if there is an export ban, a disruption is bound to happen. We can only delay it, or we can try to manage it through some kind of inventory balancing. But in the end, we've got to make political leaders understand that supply chains, by their very nature, are a global endeavor. And it's not just because due to low labor costs, we decided to outsource certain portions of the supply chain to a country. It's just because the very nature of skill and competency in a supply chain over the last 2-3 decades has become globally distributed. And if we want to continue treating patients, and not just for family planning and contraceptives, but for healthcare more broadly, we've got to respect the organizing principles of the supply chain, which are based on core competency and economic geography, which respects cost, core competency, technical know-how, cluster effects, things like that. So I think in that sense, I keep worrying a little bit that if political actions around how supply chains operate start to become a little bit more mainstream as what we've seen in the last few weeks or months, then I think we are at a greater risk of disruption the next time around. So that's one thing we've got to keep in mind. But one additional thing I wanted to highlight is that when we think about private sector partnerships and supply chains, I think oftentimes we are thinking about large companies and UN agency collaboration or a national government collaboration, but we've also got to understand that there are people in cities, in towns, who are using ingenuity at its very best. These are social entrepreneurs or someone who runs a retail pharmacy or a private clinic That's also the kind of private sector which helps build resilience in the supply chain. And in all of our dialogue, we've got to make sure that we provide an umbrella structure for them to play a part in building this new supply chain resilience. And that will also be useful in overcoming this political nationalism in the supply chain that you're describing, because then we will have almost a mass movement of people who will understand that they are contributing to supply chain resilience.
Yeah, I think, Prashant, often when people think of supply chains or of manufacturing, they think it's so straightforward to just produce something, build a factory and do it. And especially in the health sector, these are highly specialized skill sets and inputs, and these are very complex products. They're not so easy to just nationalize around the world and throw export controls on without major consequences to human health. It's an important point. Roopa, I want to bring you back into the discussion for any feelings or take you have on this. I know Prashant earlier talked about PPE and the importance of that to make sure that women have a provider they can go to and can safely go to during a pandemic like this. I'm curious your take on that or any of the other issues that we've been describing so far in the discussion.
Yeah, so I'd actually like to respond a bit to the supply chain aspect of it too, and really talk about it from a gender lens. Is the fact that really also looking at the talent pool of women. We know that women make up majority of the health workforce, 70%. But when you take a look at the decision-making roles, we just did a recent review, which will be shortly published, looking at 90 countries around the world, and women comprise only 12% of the roles in national COVID response teams. And so when you look at that gap and when you look at the issues we're talking about here, about supply chain, about contraceptives, about choice and power of choice, we really also need to talk about the leadership dimensions and really making sure that anywhere that we are having decision-making, design, of the system itself and how we're going to be building resilience in our systems, we really need to make sure that women are part of that design process. We know that women are, especially in the informal sector, entrepreneurs, and they are participating in this dissemination and part of the supply chain too. But I think being deliberate about acknowledging what are the unique needs of women to fully participate in really ensuring that we are getting our health system delivering the care and needs for all genders. So I think that that's something I'd really like to emphasize. And then particularly on the PPE, it goes back to, again, the design process. Health systems have been designed by men for men, and that's not meant to signal a gender war. It's just meant to acknowledge that if we operate in gender blind ways, we're just not going to be designing systems that work for everybody. We know that there's a gender data gap. Early on in COVID-19, very few countries were reporting data in a sex and gender disaggregated manner. And it took several months to really get into a place where we have some data on this. And so in closing, I'd really like to say on this point that, let's apply that gender responsive approach to everything we do in COVID-19, but more importantly, in health systems and health security moving forward.
It's an important point, Roopa, because these inequities, they exist not just in the population of people we're trying to serve, but in the systems themselves. And that's one reason why they're so persistent. And it's so hard to root this out. And it's important to recognize that. Mariarosa, I'm just thinking back to the poll question where we saw that public-private partnerships, what you do every day, came out at the very top. I'm sure that was good for you to see. But what do you see as the opportunity? You've got one major private sector partner here on this in this event. What do you see as the opportunity in general for at this point in the pandemic, to some degree? But just given that poll answer, I'd like to see if you have anything further you want to add.
Well, I think, Raj, going back to the question and to the options for the answers, of course, I'm happy to see that 71% answered public-private partnerships, which as you said, is our bread and butter every day. But I think it's a healthy mix of all those options. And also the local perspective, the local level that Prashant was mentioning, I think it's very important. And I think that we really need to make sure that these local actors, particularly in our program countries, for example, are part of the conversation, that they can bring an input. And that input if you ask me what could be the most interesting and most relevant type of object of the partnership, is for sure in this case innovative solutions and brain power, particularly addressing the challenges that the supply chain can have. That is key for us at the moment. Of course, financial resources are important, but it's not only about money. I would say in this case, and COVID-19 has shown that, it's about money, yes, but it's much, much more in terms of innovation, much, much more in terms of innovative thinking that really makes this issue become part of the overall agenda and pushes that political will that I think was mentioned before. Because you can build the best partnerships, the best public-private partnerships. If you don't have a framework of support around the partnership, it's not sustainable. It's going to work in the short term. It's not going to bring that impact, the long-term impact that we want to have. If we want to have resilient supply chains, I say that again, you need to have all the actors come on board. And that requires really a will behind that. So again, it's a healthy mix of all those options that bring a really sustainable public-private partnership.
Mariarosa, we've got lots of questions flowing in. I want to start to get to some of those, and some of them are for you, right on the points you've just described. You said, it's not only about money, but we've got one question about, well, what do we do in an environment where governments might be cutting back their global health spending, including on things like reproductive rights? And then what about the women at the very bottom of the economic ladder in some of the countries that you talked about before? Is price going to be a limitation for them to access modern contraceptives? So maybe you can kind of get into those two sides of that coin on the money side of this equation for us.
Yeah, I think, as you say, it's the two sides of the coin, and I think the truth is in the middle here, because of course, on the one hand, you have governments that decide to kind of cut their financial support to these services. And on the other hand, you have the private sector, for example, and the private sector that really wants to partner and wants somehow, for different reasons, and I think we need to be clear here, it's important to refer to corporate social responsibility. It's important to acknowledge that the private sector is business, basically. Now, when we talk about corporation, it's business, but business through sustainability and corporate social responsibility that is done in a certain way. So in that perspective, the private sector can, for example, facilitate access for women, the famous women that risk to be left behind, in a more, let's say, making sure that there is that universal access, for example, to contraceptives and services. So both parts of the coin need to come together. And there must be a sort of, let's say, agreement in the middle. That's the core of the partnership. That's where you really have the public-private partnership coming together.
Yeah, ultimately, you need some kind of a business model if you're trying to reach this scale. Right. But on the other hand, you're talking about reaching some of the most marginalized communities in the world. And it is a time when governments are rethinking their commitments to a lot of the global health agenda issues that we all care about.
Yeah, this is a time really where I keep on saying, in general, we need to look at state actors and multilateralism with a fresh eye, because there are other actors that can really come on board and can make sure, or help making sure that those gaps are somehow addressed.
Roopa, maybe I can bring you back into the discussion too. We had a question really about local NGOs and how do we make sure, because at the end of the day, a lot of the service provision is happening at a very local level, and sometimes with small organizations, as you talked about, sometimes women-run, women-led organizations. Maybe you can say a word or two about that question and how you think about it, about how we support those local NGOs in a conversation like this.
Yes, and I also want to just really emphasize that point about political leadership. and the commitment. And this begins at the global level, but at the national, and then trickles down really at the community level too. But really what's important to really emphasize here is that what COVID-19 demonstrates is that we really live in an interconnected world. Viruses don't respect borders or visa regimes. And we're not going to be safe until this pandemic really is addressed in every country so that everyone is safe. And so really kind of going into that lens of like, what's the political leadership really needed? And how do we get political leaders to look at investing in gender and investing in women's movements? We really need to also look at it from the fact of the resilience that is built in society when there is truly gender equitable societies. We know that there is a development return, there is an economic return, and also a gender return. Particularly when you look at overseas development aid, less than 1% actually goes to women-funded organizations, women-led organizations, and women's movements. But the social protection that is currently in most countries that is really catching the most vulnerable, the hardest to reach, the rural women, those people are actually being protected by the social protections of women's networks. But however, funding is set up in a way that it's meant to go only in large millions, trillions, billions, but rarely sort of in this smaller micro financing and cash transfers that are really needed. So when we look at political leadership and wanting to be gender responsive, so we reach all of those networks, women networks that are providing social protections in the hardest to reach people, we also need that same spirit of innovation that was talked about, the same spirit of public-private partnerships, and really government commitment to make sure that their measure of success is actually the hardest to reach places. So, again, I think these things are all very linked, but if we don't, think about gender equity as a cross-cutting issue, we are going to see generations of not only girls and women impacted, but all people impacted with extreme poverty and loss of human capital. The World Bank estimates almost up to 1 trillion will be lost in human capital if we don't start doing things differently for this pandemic.
Roopa, there's a kind of a comment more than a question here, talking about exactly along the lines of what you described of including women and girls in this discussion, and saying, what about including women and girls in partnerships between private sector, UN, government? How do we make sure they're represented so the solutions that we come up with are context appropriate? And we have another question that's come in that maybe I can throw to Prashant and Mariarosa, which is kind of pushing back a little bit on our premise today. Basically saying, is family planning really the top priority for women and men in low resource settings? Or are there other more urgent needs that we should be thinking about? So I'm just curious how you think about this. Prashant, you've been talking about the systems level, and I wonder whether maybe that mindset is quite different from this question, which is talking about needs that might be more urgent than family planning, kind of weighing one against the other. How do you think about that question?
Yeah, so I think this comes to, if we are building the system that gets medicines to people, contraceptives will be one thing that flows through the system. And we shouldn't be in the business of deciding what is highest priority, what is lower priority, right? I mean, the key premise of universal health coverage or primary healthcare is if we design the systems well, then whatever are the most pressing needs for the population, and women in this case, are met, and the supply chains don't fail them, and they don't fail them no matter where they choose to go in terms of an access point. Do they want it at the doorstep of their home? Do they want it in a clinic? Do they want it in a pharmacy? Do they want to go to a tertiary care facility? Whichever option they choose, we've got to make sure that the supply side serves them, and it serves them for whatever product they need. Contraceptives, other more pressing health needs they have. And that's the kind of system lens which we think we all have been working to develop, and contraceptive and family planning is a part of that. And we don't have to have this dichotomy that are we building this supply chain for contraceptives and family planning, and in the process are we ignoring other things? I think we're building a system of which all of these things are a part together.
Mariarosa, I see you nodding along. Go ahead and add in your thought, and then I want to get to one other question.
I was nodding because, of course, I share whatever Prashant was mentioning, and I wanted to add a bigger picture consideration to, let's say, answer this comment. I think we should really look at the power to choose, but the right to choose for women and girls. Because if you don't have that right, which we consider a human right, it's not only a matter of, yes, we have access to the method we want rather than not, but if you don't have that right, you have an impact on economies, you have an impact on productivity, you have an impact on education. So the lack of access to family planning has much, much broader consequences. And it can really contribute not only to the disruption of the health systems, but also to disruption of economies. So I think we really need to put family planning and we need to put access to contraception in the broader perspective and clearly mention the issue that we're talking about human rights here.
But so one last question, and then I want to bring Stefan back into the discussion to help close us out. We had a question about the demand side of this. You know, we're talking about this large gap for modern contraceptives. How much of the problem is the supply chain getting it to service providers, making sure they're trained service providers, and how much of it is, you know, the demand from women for these products, maybe education, cultural issues, the behavioral science questions about how to make sure you match up the system with women and their needs. How do you see that issue, Mariarosa?
Yeah, I think it's a combination. Can you hear me? Yeah, sorry. I think it's a combination of all these factors, of course. And that is why you cannot simply think about improving the supply chain. That is why you cannot simply think about the investment by governments. You cannot simply think about a UN agency that is as effective as we can in delivering. But it's really a combination. And it also has to do a lot with awareness building. It has to do a lot with broader support to communities. Again, it's important to see this issue not in isolation. It is part of a broader discussion. So I think, again, it's a combination of all these factors, but as such, it has to be addressed as a complex of measures to address it.
Go ahead, Roopa, please join in.
Yes, and Raj, I wanted to touch on the question that came up about like what role is there for the private sector to really engage women in the design process of it. And I think it really just goes back to the simple aspect, like really asking the question, are you including women? Are you including women from diverse backgrounds? Are you including community, civil society perspectives? I mean, these are all groups that are essential to being able to design products and to really even look at some of the supply chain issues that we've been talking about, and also address the demand aspect that you just raised earlier. If we are not working with the people that we're trying to reach from the beginning, how do we expect them to really uptake? And we know that COVID-19 has put a spotlight on mistrust, misinformation, and all of our role and responsibility as health providers or global health advocates is really to just build that trust, and that really begins by ensuring that they're part of the decision-making design process. So I would encourage the private sector to be really deliberate about diversity and inclusion in all aspects. And when you look at the global numbers, it is the one sector, if you take out religion, where gender parity is the furthest from being reached. Less than 5% of healthcare CEOs have women in top leadership roles. But I'd say, again, not to simplify it just as a parity, but it's much more about truly inclusion and design at all levels. And I'm really glad to hear that Bayer has shown a commitment to work on this issue together and really see that providing contraceptives is a means to gender equality. But let's think about how we can go further and include women and communities in all of the decision-making process too.
Yeah, it's a great point, Reuben. I feel like the global development sector increasingly is taking a hard look in the mirror and realizing that if we don't change the way we're structured, if we can't change from being such a top-down and often unequal sector ourselves, how are we ever going to address massive gaps like the gap that we're talking about? And in the end, it is about listening to people that we're trying to serve, and hearing their voice. It has to be part of getting to the results we all want to see, these big numbers that we're putting out in a conversation like this. So thank you for that intervention. And just maybe a final thought, Prashant, from you as we close out our panel session here.
Yeah, two things. So one is a lot of the ability of the supply chain to respond quickly, to deal with any potential disruptions, depends upon having very granular demand understanding. Like, where do women go? What is the pathway they choose? What is the choice? How does the choice process work? And oftentimes we think of those as an afterthought in the supply chain design, but I think we are starting a movement where they should become the forethought in supply chain design. So I think that's where we want to see more partnerships. And the second is that the organizations that deliver product to a facility, a clinic, a shop, a woman's doorstep, the delivery organizations, we also want to ask the question, are women leading them? Are they a part of such organizations? Is the person who comes to deliver the box of contraceptives at the door a man, or are women playing a key part in how that works? And there are immense opportunities for partnership that, in my opinion, lie there.
It's a great point, and there are examples of failed family planning programs that fail precisely because people forgot to take into account those kinds of questions, those very kind of basic behavioral science questions about who's providing the service. Are we creating a comfortable and open opportunity for women to seek the care and the services that they want? And that's really essential to solving this challenge. I hope all of you virtually are joining me with a huge round of applause for this group of panelists. It's been a fantastic, interesting conversation. You've illuminated so many key questions in my mind, and I know in others who've joined it. There are many other questions that came in we didn't get a chance to get to. I thank you for all of those. So please join me in thanking the panelists. And I want to bring Stefan back in to help close out the event today. And really, Stefan, you've had a chance to listen to these conversations as they've developed and a lot of the questions, and I want to just give you a chance to add your own take at this point.
Thank you, Raj. And first of all, let me start by congratulating not just the panel, but the organization and also the spirit that we were witnessing all along this last hour. And if that is the new normal, then I'll be gladly participating in that new normal. For us, and I think for everyone here on the panel, universal healthcare and access to health is more important now than ever before. We all contribute in different fashions to that access to care and to also improvement in the quality of care. In our industry and in our company in particular, it goes beyond the pledge that we made for the 100 million women. It's the passion, the purpose that all our employees feel every day as they serve patients around the world, as we serve women around the world in making their choice in contraception, but also in other areas where we're active in healthcare. In low and middle income countries, I think it's more and more our ability to also price medicines accordingly so that access is possible and is adapted to local purchasing power. And I'm extremely proud to see how we're dealing with that in a truly differentiated pricing according to the economic capabilities that exist locally. The lessons from COVID-19 have shown the need for systems-based approaches, collaboration, we've talked about this, across borders, and decisive actions where we not just deliver, but we do that also at speed. So the cross-sectorial collaboration is really essential to support improved economic outcomes for women. We've talked a lot about COVID-19, and sort of like keeps on being the point we always come back to, but it really has demonstrated the power of true partnerships between the public and the commercial sector, the private sector, for the benefit of a shared goal, which is solving pressing public health issues and challenges, and in this instance here, for women in their ability to choose for themselves. We need to really ensure that we build upon these learnings and that this new normal or this new whatever together helps us move into the era post-COVID so that this crisis doesn't go to waste. thank you very much again for having me and having us. I really enjoyed this program, and I look forward to more in the future. Back to you, Raj.
Yeah, thank you, Stefan. We really appreciated your participation today and getting to work with you on this. Again, as I mentioned in the beginning, I still remember speaking with some of your colleagues and being in Nairobi, Mariarosa, at your big summit and hearing this 100 million commitment. And it is a staggering figure. And I think one thing that comes out of this conversation today is there's no way any one UN agency, any one corporation, even as large as Bayer, can ever hit a figure like that without the broader global health and development community working together, and without the kind of lens that Roopa and Prashant have put on the conversation of making sure we're listening to local voices, to people who are really providing service around the world, who are a key element of this. So I think the conversation has really gone around, and we've gotten to lots of the key points. And as you say, this is a new normal. And if this is a new normal, maybe something good can come from it. The urgency, the sense that there is possibility when we work together. So thank you to our incredible panelists, for all of you for being a part of this. Thank you to Bayer and to Stefan. And thanks to all of you who've joined the conversation from all over the world. I think the illustration shows you a little bit about how much we got to get into today. Thanks to Chris Shipton, our illustrator, as well, and to the whole team behind this event. And stay tuned to Devex for much more on this and other global health topics. Thank you.
Thank you. Bye.